All right, thank you for coming back. I'm really thrilled to introduce Helen Bevan. Helen is the Chief Transformation Officer at NHS England, and as mentioned earlier, she's linking in virtually, so we're keeping our fingers crossed for the technology. We have tested this a few times, so we're looking forward to this. Helen's a very high energy individual, so I'm really looking forward to this session, so I hope it's great for you. Thank you.
Okay, good morning, Helen.
Hi Anne and Richard, can you hear me okay?
Yep.
Fantastic. So, should we just get going? So hopefully everyone can see the presentation there. So what we're going to talk about together for the next hour is about leading change into the future. So, we've been talking this morning earlier about innovation, about how our health and care system is going to be changing so much over the next period. And what we're going to talk about now are some of the bigger themes and trends and directions in the bigger world of change, and what it will mean for us in health and care. And the image that I'm showing you here is the image of a social movement and lots of people coming together with a common cause and purpose, things that they feel passionate about. And I think that's one of the big directions that we're going to see in terms of our health and care system. The other thing I just wanted to say is I've loaded all these slides onto a program called SlideShare. So if you want to either download them now and watch them as we go along, or you'd like to download them later, all you need to do is just follow this link. So it's goo.gl/JYQ capital Y capital C. So hopefully you might want these slides as well. So I work as part of NHS England. I work in a small team that's called the Horizons team. And what we do is we help people to become or to be effective change agents. And, change agents, they work with agency. And we're going to come on and talk a little bit later about this idea of agency. Agency is about people's ability, having the skills and confidence to make change happen. And what we do in the Horizons team is we link up with other people all around the world who are interested in large-scale change and transformation and innovation. We work with people from many different industries as well as other health and care systems. And what we seek to do is to find out about the latest practice, the latest techniques and approaches and learning, and bring that thinking and practice back to the NHS so that we can become more effective in the NHS in terms of how we go about change. And, the people in our little team have worked in and around the NHS for a long time, so we bring a lot of experience. And I think one thing that you'll see from my presentation this morning is the older and wiser and more experienced I get, actually the more radical I get. So let's start off by looking at some of these themes and trends. And whoever we work with, whoever we're talking to across the world, whatever industry people are from, people talk consistently about three big themes in change. So let's talk about those. Okay. The first thing that we see is that across the world, across multiple sectors and industries, is that change is becoming more disruptive, bigger scale, faster. And sometimes for us in health and care, people say, oh, there's just so much change going on. We've got change fatigue. We're worn out by change. But the reality is, if we look forward and we look at the trajectory of change, it's going to get faster and faster and bigger. So, there'll always be a place for small-scale incremental change. But in a sense, we've got to be geared up and we've got to be organised and we've got to be ready for doing very big change. Now, if we look at what that means across the world and how other industries are reacting to that, one of the things that we're seeing, is many organisations and systems are stopping doing very big, large-scale change projects. So I took this quote here from IBM. But basically what they're saying is, if we do a massive 2 or 3 year change project, it can be great when we start it, but change is happening so quickly that we can get 2 or 3 years down the line and our change is irrelevant. So what we're seeing more and more now is organisations and systems shifting to doing much smaller scale but fast change projects. So, we talk about 30, 60, 90-day innovation projects. So even when we're doing very big complex changes, okay, we organise it into these 30, 60, 90-day cycles. And at the end of every cycle, we review it and think, what do we need to do next? What do we need to do next? What do we need to do next? And I think we'll be seeing that much more in the NHS and wider health and care system. The second theme that we see across the world is this idea of what I'm calling here the acceleration of connectedness. And what we mean by that is, in a super connected world, all of us can connect to virtually anyone, anywhere else in the world with very little effort, very little cost, 24 hours a day, 7 days a week. And it means that in terms of who we're talking to, how we're connecting with people, how we're creating knowledge is changing massively. When you think back 10 years ago, we didn't have Twitter, we didn't have Facebook, we didn't have Instagram, we didn't have 3G, we didn't have the cloud. How did we cope? And just the very fact that I'm here talking to you remotely today, this probably wouldn't have happened 3 or 4 years ago, or the organisers of this event, like Anne, wouldn't have had the confidence that it would work. And yet, here we are talking remotely. And in this very connected world, we're learning some very interesting things about how to make change happen. So one of the things that we're learning is through advanced social analytics, we can look at our organisations and we can find the people who are the most connected people. And this organisation here, Innovisor, who's done this research, what they're finding is typically about 3% of people in an organisation or system typically drive conversations with 90% of the other people. So, if we want to make big change happen across the trust or across the wider system, when we talk about our sustainability and transformation partnership, our SDP, okay? Rather than having to kind of push things down from the top or the middle of the system, let's find those 3% of people and let's work with them, because actually they're often very effective influencers and change agents. And typically those 3% of people aren't the people at the top of the organisation or the most senior leaders. They're just people in the system who are hyper connected and hyper trusted by other people. We're also learning a lot around how can we spread new knowledge. So if we want people to work in different ways, we want people to learn quickly. What we're learning is the most effective way of doing that is to have conversations, social connections, discussions. So, in terms of, your meeting today, hopefully you're meeting lots of new and interesting people and having conversations. Because what the latest evidence is showing us is having conversations, having discussions is 14 times more effective as a way of spreading change than written down things like standards or best practice databases or toolkits or things like that. And I say this as somebody who spent the last 20 years in the NHS writing toolkits. Toolkits for improvement can be very, can be helpful in one way, but they're only useful if people are actually connecting and having discussions around them, okay? So in a sense, we need to be geared up for creating the spaces in this hyper-connected world where people can have great conversations and discussions with each other, because that's the best way to be spreading new knowledge and to be learning. So, the third big trend that we see across the world is that hierarchical power, okay, the kind of power that comes from being the most senior person in the system, it's diminishing. Note that I said diminishing, I didn't say diminished, okay? It's different. So we are living in this, you know, this world of big change, disruption, accelerated connection, and yet when you think about how we organize our systems, they haven't changed in a very long time. So here's an example, okay? This is a structure chart from the Tabulating Machine Company of 1917, okay? 100 years ago, okay? Look how they are organized, you know, we've got the people at the top of the system, and we've got other people in the system operating, you know, organized into very neat departments and divisions, okay? If you look at any NHS trust today, it's still organised in exactly the same way 100 years later. And yet in 100 years, our world has changed massively. Now, organising in this way, through a hierarchy, has got a lot of benefits. And it's particularly useful in a world where things are very stable, the work is highly replicable, and it absolutely makes sense to organise people into neat divisions or departments, you know, because that helps us to get the work done. The problem in a world of such fast-moving, connected change is, first of all, it can take a very long time for things to work through the system and for change to happen. And secondly, hierarchies don't like to take risks. Okay? So in a world, I know you've been talking a lot today about innovation, where we're trying to do things in radically different new ways, organising in hierarchies, you know, aren't necessarily the best way of making, you know, a new practice happen. Okay, it's not to say that I'm anti-hierarchy, because I'm not, because actually I don't know a single organisation that hasn't got some kind of hierarchy. All I'm saying is that probably for making big change happen, hierarchy on its own isn't enough anymore. I'll just show you a little bit more evidence. Again, this comes from Innovisor, which is this organisation that does advanced social analytics that enable us to understand organisations much better. So what we can see here on the top left-hand side is a classic, you know, organisation chart. But more and more, as we become connected, the real organisation chart might look a little bit different, because people are connecting with other people all over the place. And again, this data that Innovisor show us tell us some quite stark things. So if you look in the top right-hand corner of this slide, what it's basically telling us is, you know, organising in departments and directorates, you know, makes a lot of sense, okay? In 2005, only one person in a department or directorate was working regularly with lots of other people from other departments or directorates. By 2015, 10 years later, 9 out of 10 people are working regularly, you know, across departments, across silos of working. So what we're saying is, on their own, okay, you know, this way of working, divisions, directorates, aren't enough. I'll just show you an example from the clinical world. This is an example from a really excellent new publication. It comes from a guy called Jeffrey Braithwaite, who is in Australia. And when you get these slides, you can click on the links and you can see all the background documents. And what he was doing, him and his team, were looking at collaboration amongst a team of cancer clinicians and researchers, and how much more complex and connected their world had become. And they tracked this team between 2012 and 2013. You know, and what you can see here is that in 2012, this team had, you know, quite a lot of connections, but as time has gone on, their connections have got more and more complex. And that's happening to every one of us in the world that we're in. So in a sense, we've got to be geared up for working in this much more connected world. And you see, these things that are happening, actually, we don't maybe talk about it very much in these terms, but actually it's all about power. Power is shifting. Power is shifting in the health system, and power is shifting more globally. What do we mean by power? I like this definition. This comes from Bertrand Russell, who is the father of modern logic. And he says, actually, what power is about is having the ability to achieve your goals. Now, I'm going to show you a really fantastic framework now. After I've shown you this, I'm going to stop and I'm going to give you some time to talk to other people at your table about this. Okay? This comes from a fantastic new book that is going to be published in April 2018 called This Is New Power. The authors are Jeremy Hymans and Henry Timms. Okay? This book is going to be the leadership publishing sensation of 2018. It's already been sold into 60 different languages, and it hasn't even been published yet. Okay, so next year you might meet some people and they're saying, hey, have you seen this really great new book about old power, new power? And you just say, do you know, in our trust we're so ahead of the times. We knew about that last October. So let me tell you about it. Okay, old power is the kind of power that is about positional authority. It's like a currency, like money. A few people have got a lot of old power, and most of us haven't got that much. So it's the kind of positional authority that's held by a few people. And the thing about old power is it gets pushed down in organisations, and we get commanded to do things. So you have to do that because it's the government target. You have to do that because it's a standard operating procedure. You have to do that because it's the performance agreement. You have to do that because it's in the contract with the commissioners. And the thing about old power, okay, is that it is closed. So when you think about your trust, okay, so the chief exec of NHFT is doing some fantastic work with leaders in the local community, okay? We can command people in our own organisations, but we can't command those community leaders that we're working with to do anything. And largely, old power is about transactions. It's about holding people to account. It's about systems and processes. It's about governance mechanisms, okay? Very important, but it's not the only form of power. What we're seeing increasingly in this more and more connected world is the rise of new power. And new power is like a current, okay? It's like a form of energy. And the more people coming together with the same goals, the same values, more power is built. And what we can do with new power is that we can pull it into our organisations and systems. You know, it's shared. It's shared by everybody who wants the same things, that are mobilised by the same calls. And it's open, okay? You know, whether you're in the FT or you're a community leader or you work for the CCG or you're a patient or family member, you know, you can all be part of new power. And the most important thing about new power is that it's based on relationships. You see, one of the big differences between new power and old power is that when I engage in new power, then I do so because I choose to do so. You know, it's because, you know, being part of this movement or this campaign or this cause fits in with who I am in the world and my values and the things that are important to me. So I trust when I give my time and I make an effort freely that things will get followed up. Because if they don't get followed up, I won't bother again. So, you know, whereas new power is typically about, you know, I'm choosing to do this, old power is, you know, I have to do this because it's it's my personal accountability and my role, or it's the targets that my organisation, you know, is being held to by the bigger system. Now, there's no right or wrong here. We're not saying old power is bad and new power is good. We're saying both kinds of power exist and we have to work with both of them. And often as change agents, you know, where we have to be working is in that very difficult zigzaggy place, you know, in the middle. And, you know, new power is great, but I see so many change agents and innovators and activists in our world of health and care who are doing lots of great stuff in new power ways, but ending up, because they can't connect with the old power, they don't get anywhere. And what I'd also say is, when I look across the NHS and I look at the leaders that actually inspire me the most, you know, the really senior leaders, the chief execs and so on, who inspire me the most, they're the people that have got old power authority and they work in new power ways. So a lot of the people that I get to work with as a transformation leader, okay, the futurists and the people that are looking forward, you know, they are predicting the demise of old power. Okay, I don't think that old power will be dying in any healthcare organisation that I know anytime soon. But what we're seeing is this layer of new power coming on the top that's creating all kinds of opportunities. So I know, for instance, later on today that you'll be talking about your pledges for Fab Change Day. And Fab Change Day, I think, is a really great example of some of the ways that we can build new power, and we have to work with both. So what I'm going to do, I'm going to pause there, and I'm going to give you about 3 minutes. So have a chat with other people on your table. Okay, what's happening in your world of old power and new power? What does it mean to you? And what are some of the opportunities that you've got to work with both? So Anne is going to manage things from your end, and in a few minutes' time, I think I'll give you 3 minutes and see how you're doing. We'll get back together. So have an old power, new power chat, and over to you.
Okay. It's because I've got my mic on. Welcome back, Helen.
Yeah, hi Anne, can you hear me?
Yeah, we can hear you.
Fantastic. Do you know what would be really great? You know, in terms of our experiment today in connectivity remotely, I would love to hear if there are a couple of people that would like to share their virtual insight on old power, new power. There are a couple of people there, Anne, who'd like to tell us what they're thinking about old power, new power.
I'm sure there is. So, any volunteers? Go on, Nicky. Go on, There you go, Nicky.
Thank you, Anne.
Hi, Nicky.
Hello there, Helen. We were just talking a little bit about what it feels to be like an NHST in the old power, new power balance, and we were trying to get a sense of whether NHST feels much more drawn towards the new power, and I think we agreed on our table that that was the case. But we equally were putting forward some thoughts around where we're working in an environment where some of our partners are still very much old power, and we are in that fuzzy white line in the middle.
Yeah.
And how you have to be able to flex to be able
Yeah.
to accommodate the old power needs, but equally be innovative and forward-facing and working collaboratively to be part of the new power.
Yeah, fantastic points. Absolutely.
Thank you.
Really great. Thank you, Nicky.
Okay, have we got any other volunteers?
Yeah, just maybe one more would be great.
Yeah, I'm sure we have right at the back of the room. Hold on. Thank you.
Am I on? Yeah. No.
Yeah, and who?
About more around the new.
Yes. Do you want to say hello? You are.
I'm Katie, and I'm a diabetes specialist nurse.
Hi, Katie.
Hello, Helen. We were thinking about the new power with our patient groups, particularly around our partnership working.
Yeah.
If you're told what to do, but working out and helping them find the answers to manage themselves, that's very much a new power philosophy rather than the old power of what to do. And we see that as a key part of our clinical workload, and I'm sure that's reflected in other groups that we do as well.
Oh, we've lost you, Helen. No. No, we've lost you. Got no sound.
I'm back now. Can you hear me?
Yes, we can.
Yeah, fantastic. So I think the points that both Nicky made and Katie made were fantastic. And you know, too often we work with patients and families and service users in old power ways. So we think, oh, you know, we need to have a patient representative. So we bring one patient or one family member and put them on a committee, and we wonder why it doesn't work. So actually, you know, I think that the kind of new power ideas around how we work with patients and communities are so important. You know, it's about a partnership. It's shared. It's coming together. It's open. So you know, I'm delighted to hear that. So, are we happy that I carry on? Yep. So, you know, sometimes people say to me, you know, it's so difficult to make change happen in my situation because I'm only a staff nurse, or I'm only a trainee doctor, or I'm only a support worker. And, you know, all of us have got the power to make a difference. And I just wanted to share with you some really interesting research. This comes from two Canadian researchers, Batalana and Casciaro. And they published it in this report, or this research paper, which was called The Network Secrets of Great Change Agents. And what they wanted to understand is, in an organisation or a complex system, what does it take to be an effective change agent? Are the most effective change agents the people with old power, or are they the people with new power? Batalana and Casciaro, they went into a very big organisational system, and they followed 68 change projects around that big system because they wanted to understand, okay, what were the characteristics or circumstances of the people that were the most effective change agents. Okay. Does anybody know the name of this very big organisational system that these two Canadian researchers went round? You can't tell me anyway because you're mute, so I'll tell you. it was the English National Health Service. Okay, they followed 68 change projects around the NHS, and what they found was that being an effective change agent, the kind of people that were the most effective change agents were the people who were at the centre of the informal networks. Okay, and being a hyper-connected person was much more important in terms of being an effective change agent than being somebody who was at the top of the formal system or the hierarchy. You know, so all of us, whatever we do, however lowly we are in the formal system, we have got the power to be an effective change agent, and we do that by connecting with other people. So I'd say, you know, the key thing about being an effective change agent is you can't be an effective change agent on your own. So however creative or innovative or however much passion we have, unless we connect with other people, it's really hard to be a change agent. Now, I do a lot of work with SDPs. So the groups of leaders around the country who are coming together as system leaders to seek to make big change happen. And I just want to show you a kind of perspective on this that ties in. So one of the key things that we should think about is if we want to make big change happen across the system, who are the people that can make big change happen? Now, let's first of all talk about list A. And you'll have locally your own version of this, so the names might not be the same, but you know, you kind of get the hint of it. Okay, is it the STP delivery board or the transformation delivery board or whatever you call them? Okay, is it the senior leaders from across the system who support the change? Is it the PMO, the program management office? Okay, is it the 17 work streams of our SDP? Is it the people that are the formal clinical leads? Because we know that we can't make change happen in a clinical environment unless it's clinically led. Is it all the directors of the participating organisations? Or is it the people that have got a formal role as a leader of change or a change facilitator? Okay, that's list A. Are list A the people that make change happen? Or are they list B? Okay, who's in list B? The mavericks, you know, the rebels, the people that kind of want to do things differently. The positive deviants, and the positive deviants are the people that are already doing things differently and somehow they're succeeding and actually showing the way to the rest of us. Is it the non-conformists, who are the people that like look at the world through different lenses and can see the world in different ways? Okay? Is it those hyper-connected people? Now the thing about hyper-connected people is if hyper-connected people agree with your change and they're on your side, they're fantastic, because you know these are often the hyper-connected people are those 3% that we talked about earlier. You know, they're the people that are connecting with everybody else. They can spread behaviours, they can role model things at a massive scale that most of us couldn't even dream of. They set mountains on fire and they multiply anything they get their hands on. So if your hyper-connected people are champions of your change, that is so powerful. If your hyper-connected people are opposed to your change, then you have a bit of a problem. And then the last category is hyper-trusted people. And again, lots of reasons why people are hyper-trusted, it doesn't matter which. The fact is that they are. So if we're trying to make big change happen across an organisation or a system, who are the people that are going to make the change happen? And you know, actually, it's both. We need both. However, what we need to understand is the people who live and perform in formal organisation land, which is list A, and the people who have got the power, there's that word power again, to make or break change, the people in list B, they're two different lists. And again, you know, very often, when I look at the sustainability and transformation partnerships that I get to work with, very often we over-focus on list A and we under-focus on list B, and we need to be working with both. And there's so much evidence, you know, that backs this up. So I'm just going to show you one. This is research from David Dinwoody. And let's start here on the top left-hand side. Okay, what his research shows, if you look at big transformation programs, so across whole organisations and whole systems, okay, most of them actually fail to achieve their objectives. And that's as true in health and care as it is in other industries and other sectors. Okay? But then if you start to look at why they fail to achieve all their objectives, I mean, it's complex and there's lots of different reasons. But it's rarely they rarely fail because we didn't bring in McKinsey or PwC or some other group of clever people to do analysis for us. And it's rarely because we didn't have a good enough structure or a good enough plan. Okay? Big change programs fail much more often because we don't take account of the informal networks in the organisations and systems affected by the change. So we don't think enough about new power and we don't think enough about List B. So if we want to make really radical, innovative, transformational change happen, okay, what we need to do is, as well as working with the formal leaders, we need to work with all those informal leaders, you know, the people that want to contribute, whether they're in List A, List B, new power, old power. Okay, so we need to find those List B people and we need to be working with them. And what I love about your meeting today, and just looking who's there in that room, you know, there's a fabulous mixture of old power, new power, and List A, List B. And I think, you know, I know you've got the HSJ coming tomorrow. And I can see why you are a contender for Trust of the Year, because what I see in your organisation is, you know, just how well you're working with both. Let me show you some more evidence that I really like and I find very helpful. Okay, this comes from a guy called Mark Jabin. And Mark Jabin is an emergency physician in the USA, but he's obsessed, or he's kind of made it his life's mission to learn about the science behind resistance to change. And he said, okay, I'm going to show you two scenarios, how to go about involving people in change. He says, the first picture I'm showing you here is what not to do. Okay, so if we want to get resistance to change, this is how we do it. We come up with some big issue, like, you know, we've got a real problem in our organisation about a particular aspect of patient safety. So a small group of people come together and say, you know, we've got this big problem, we just need to get it sorted. So that small group will come up with the desired outcome. So, you know, this is where we are now and this is where we want to be and there's a gap. So what do we need to do? So they come up with this small group of often very senior leaders will come up with a series of options and they will make a choice. This is what we need to do. We've got this gap, we've got this problem. And that's the point at which we engage people, when we've decided what we're going to do. So at that point, we've made the choice around what the change is going to be, and we try to get other people to buy into it. Okay? That's what we do all the time, and it's what we shouldn't do. So what should we do? What Mark Jabin says we should do is we should engage people much earlier. So as soon as we've worked out there's an issue or a problem, that's the point we start to engage people. So when we talk about, you know, coming up with a desired outcome, we make that a shared outcome. We need to be involving all those key people, the new power, the old power people, the List A, the List B people, you know, whoever needs to be involved in it. So we create this shared outcome and we brainstorm options and they're shared options. And we make a choice and it's a shared choice. And he said, you know, one of the biggest problems, you know, why we get resistance to change in the healthcare system is because we want people to be buyers. You know, we talk about buy-in to change. He said we should ban buy-in to change because it's too late. Okay, we don't need buyers, we need investors. So I think I'll stop there again. I think just for a couple of minutes, Anne, if you can manage this. So what's happening in your world in terms of buyers and investors, and what opportunities have you got to create investors rather than buyers? So I'll disappear for 2 minutes and I'll come back and see how you're doing. So over to you.
Lindsay.
Yeah. Hi, Anne and everybody. I'm back. Hi. So could we maybe just take like one point? Is there somebody else? Is there somebody different this time who'd like to tell us about buyers and investors?
Have we got a volunteer? Who's going to feed back to Helen? We've got a volunteer.
Someone like to tell us?
Otherwise, we'll just pick on someone. Yeah.
Oh, yeah, great. We like volunteers, don't we? Yeah. I can't hear you very well.
Is that better?
Yeah, much better.
Yeah. Hi, Helen. It's Lindsay.
Hi, Lindsay. Hi.
We were just kind of thinking about our interactions with primary care. Our role is
Yeah.
very much about working in partnership, but we're kind of stuck in that place of that contradicting desired outcomes, really. We
Yeah.
have an idea of where we want to move forward, but they've got an idea of what they want from us. And
Yeah.
that's just really difficult to move beyond that point and come up with the options for both of us. We seem to keep hitting brick walls, really.
Yeah. So what have you been trying?
Well, we've had sort of several workshops that have sort of brought everyone together, but nothing seems to move on from those workshops. Informally, we get, say, a GP practice saying, "Can you help?" And we'll go back and say, "This is how we can help," and then that's into it, because it's not the help that they want. They've got a different idea of what they want us to do.
Yeah.
It's really difficult.
It is very difficult.
Negotiations going over a huge trust, over a huge area.
But do you know what Mark Jabban would say about that situation is you know, very often when we're having those conversations, we're having them around what is the right thing to do, and what he would say is go up a level. So actually, rather than, you know, having a conversation about what should we do and what are our options, he said to go up a level and to always think about the outcomes and the things that we want to share. And again, you know, if you think about the most successful social movements, that's what they do, you know, because if we can unite around our dream or the thing that we want to achieve, and if we can connect on the level of our bigger goal, and we can connect on the level of values, then when it comes to thinking about options and choices, he would say it should be more straightforward. So I don't know if that's helpful, but that's what his science would say.
Okay, thank you.
Yeah. Anyway, thanks for asking that. That's great. So, Anne, is it okay for me to move on?
Yes, of course.
Yeah, fantastic. So, and thanks, Lindsay. So, you know, what we're seeing more and more is these kind of, you know, lots more interest in kind of social movement ideas, or health and care as a social movement. And I think, you know, it ties in with these bigger changes that are happening. And one of the ways that we see this happening is something that is called MOODOCs. And MOODOCs are massive online open disease-orientated communities. And what we see is, in this hyper-connected world, patients across the country and across the world aren't waiting for the health and care system to kind of, you know, to support them or give them expert advice. What they're doing is that they're linking up with other people that have got the same long-term conditions or the same diseases or in the same circumstances. And what we've seen, like in the past 5 years, is this massive growth of MOODOCs. And if you look here in the bottom right-hand corner, you know, globally we're seeing something like at least 60,000 online diabetes communities and around 80 million different online patient communities at the last count. The other thing that's happening that I think is fueling this is you know, we talked about trust, and when we talked about new power, we said it's all about relationships and it's about trust, okay? Trust is changing. So there's this global survey which is called the Edelman Trust Barometer. And every year for the last decade, this company, Edelman, has been assessing how much trust people feel. And what they found this year, in 2017, for the very first time, is that people are, in general, because they're talking about thousands of people, people trust peers as much as they trust professionals. Okay? And that's never happened before. People have always trusted experts and professionals more. But the nature of trust is changing. So people are trusting their peers as much or more than they're trusting professionals. And again, MUDOCs are part of this. And just give you one example here, the Metastatic Breast Cancer Project. That's an incredible project. All based on social media and virtual connections. You see, people that are doing research in metastatic breast cancer, under the old system, before the days of virtual connectivity, if they wanted to connect with people who have got metastatic breast cancer, they would have to do it, go through like 3 or 4 layers, through their university research departments, through hospitals, and so on, to connect with patients. Now, they can connect directly, and obviously there's a lot of ethical principles in this. But it means that researchers, because they're connecting directly with patients, their research is moving forward so much more quickly. And it also means that people with metastatic breast cancer, very often who are involved in this project, really feel they're contributing. Because one of the things that we know about community and that we know about people receiving healthcare is people don't just like to receive, people want to give. We've all got that tendency. So people that are very ill with metastatic breast cancer, by taking part in this project and connecting with other people in a similar situation and clinicians and researchers, they're actually contributing in a very obvious way. So, the world is moving forward. The other thing I'd say is that in terms of my team, the Horizons team, the thing that we're being asked to do more than anything else is to support teams and systems to bring social movement thinking into their work. And I think that trend is going to continue. And here's an example of bringing social movement thinking in. So when we think about like the resources that we have for change, we're living all of us in a very, very resource constrained era, okay? And it's absolutely tough for all of us. But you see, if we think about resources for change in an old power way, we think about resources being economic resources, that there's only a finite amount of money. So once, there's a certain amount of money that's available for the things that are really important to us. And once we use those resources, they're finished, okay? So there's only a certain amount of money for doing things, there's only a certain amount of materials, there's only a certain amount of technology, okay? So it's finite, and the more we use it, the more it diminishes. If we think in new power ways, or social movement ways, actually we start to think about resources in a different way. We start to think about the assets of our relationships, the commitments we make to the things that are important to us, to our community. And the fantastic thing about social resources is that they grow with use. So the more we use them, okay, the more we build relationships, the more we connect, the more we use the assets of our community, the more our resources for change grow. And globally, one of the most important thinkers, with regard to healthcare improvement is Don Berwick from the Institute for Healthcare Improvement in the USA. And he and I were having this conversation, and he said, one of the biggest problems, he said, that I see in the NHS in England is that very often our strategic leaders who are trying to solve very, very difficult problems and challenges, they don't see these amazing resources in the system, the communities, the relationships, the commitments, they don't see them as the solutions to the biggest problems. And Don Berwick thinks, actually, those connections and communities and that new power is actually one of the most important parts of solving our problems. And I think that too. And I think our strategic leaders will see it in time. But we're not quite there yet. So Very final thing that I want to talk about is about platforms, okay? One of the big themes and trends that we're seeing in change across the world is the rise of platforms. And what we mean by that is a space or a place where people can come together and share and learn and grow. And very often we're talking about digital platforms, we talk about Facebook groups with our patients. We talk about crowdsourcing platforms where we want to answer questions. Okay, we also platforms can be virtual places, because in a sense what you're doing today with NHFT Live, okay, the space that you're creating together, that's a platform, and more we're understanding that if we want learning and innovation to happen more quickly, we've got to provide these spaces, okay, for people to create value together. So whether they're face-to-face platforms, which is what you're doing today, or they're virtual platforms, we've got to create platforms. And we're seeing this all over the world in terms of the ways that organisations are doing innovation and research and development. Okay, this is fairly recent. This is PwC's Global Innovation Benchmarking Survey. And what it's showing is the way that people and organisations are doing innovation is changing rapidly. And we're moving away from some of the older ways that we did things in terms of investing in startups and internal incubators to working in platform-based ways. So open innovation is a very new power way of doing innovation. So I've got a problem or challenge, instead of getting the experts in my organisation to do it, I open it up and I say to people all over the world, come and help me with this innovation. Okay, design thinking, co-creation, both these are approaches where we design things together with our patients and communities and our staff at all levels. Design thinking, co-creating are what Mark Jabin would call investing in change rather than getting people to buy into change. It's the way the world is going. So finally, I wanted to show you one of the change platforms that my team has run. So we ran a change platform with the Health Service Journal and Nursing Times, because what we wanted to understand was, how can we do change better in the NHS? How can we tap the collective brilliance of our amazing workforce and our patients and communities? Okay, so we set up a change platform, and it was a virtual platform. Okay, it was a virtual system that we wanted people to log into and put their ideas across. And what was amazing was 14,000 people contributed to our platform. And the first thing that they came up with were the main reasons why why change doesn't work. What are the biggest barriers to change? Okay, and these are the things that they came up with. And don't worry, we're not going to go through them all. Okay. So when I look at what our frontline workforce said were the biggest reasons that change doesn't work, I don't think there's anything in there that particularly surprises me, except the number one barrier, which hadn't occurred to me, honestly, before, was such a big barrier, which is confusing strategies. And what so many of our frontline colleagues said is, what keeps happening is our senior leaders will come up with a new priority or a new idea, and they kind of lob it over the parapet to us at the front line and say, you've got to do this new thing. Or, there's a new government target, so we get told, this is the new target, you've got to do this. And the problem for us at the front line is that we don't understand whether we've got to stop doing something that we previously did, or we've got to combine it, or how things fit together, or what we're meant to do. And what was interesting was the Gallup organisation, big global research organisation, did a study of why change projects fail at the same time, and they came up with exactly the same thing. They said that in terms of what people reported back to them, the biggest problem in terms of why change didn't get implemented was because leaders, if you look here on the left-hand side, at the top of the organisation, okay, would have like 10 priorities. But by the time it got down to the people at the front line, there'll be so many different priorities. You know, we didn't know what was the most important. So biggest piece of feedback, when we're putting new change in, how do we frame it? Do we tell the story of it? Do we create a narrative for it that makes sense to people in terms of how it fits in with other things? Okay. Really finally, we also asked our frontline colleagues, okay, what are the things that build change? Okay, what are the key things that we need to be doing as a system to build the blocks for change? And again, I'm nearly out of time, so I won't go through these, and I never intended to in the first place. But if you just look at these things as a whole, okay, that our 14,000 contributors said to us, there's a big theme that comes out. Now, just after we did this, Google, the Google organization, published some research that was called Project Aristotle. And what Project Aristotle was the most in-depth, longitudinal study that has ever been done in a single organization. It was done in Google about high-performing teams and what makes a really high-performing, innovative, creative team. I'll just show you what they found, okay? What they found after doing Project Aristotle, this really intensive analysis, the key to high-performing teams that deliver change is being nice, okay? And they found that was more important than any other factor. That was more important than having the most talented people in your team. So, you know, when we've got bosses that that are really supportive of us, where we've got a great atmosphere in our team, where people cover other people's backs and we can be innovative, okay? That's what is the most important thing when it comes to having high-performing teams. And it's interesting because actually, if you look back at what I said in terms of what our frontline NHS staff said about the most important building blocks for change, they're saying exactly the same thing. Often the technical term that we use is psychological safety, okay? But it's teams where, you know, people support each other, they've got leaders that they trust, that trust word again, okay? That creates the conditions where people can innovate and make new things happen and perform really well. So the very final thing I wanted to say is, what do I think about the way the world's changing? Okay, this didn't come from the NHS or healthcare, but it could have. Dov Seidman, he says, the last era of management was about how much performance we could extract from people. The next era of management is all about how much humanity we can inspire. So I think, you know, all of us are working in very, very tough circumstances, okay? I think it's the hardest it's ever been to do the kind of jobs that we do in the NHS. And yet, I feel immensely hopeful. So I hope that's been useful. I hope there's been some things in there that have spoken to you, and good luck with the rest of your day. So thank you.
Hi Helen, it's Richard.
Hi Richard.
Thanks for that. It was really lots of really compelling ideas and lots of inspiration, and it's been a great test of the technology as well. So I really appreciate you joining us today. Thank you.
Yeah. Oh, it's my pleasure. Absolutely. And good luck tomorrow, and I hope you win.